Well, here in Canada, wait times for COVID-19 tests continue to balloon, especially in hotspots like Toronto and Ottawa. Joining me now is Dr. Raywat Deonandan, a professor and epidemiologist with the Faculty of Health Sciences at the University of Ottawa. Doctor, thank you so much for joining us. A lot of issues we want to get to. I want to talk, first of all, about the testing numbers in this province. We've seen the long wait times. People are waiting hours in some cases being turned away. We're looking at different options. Pharmacies being one of them. How viable is that?
It's viable. We use pharmacies already for giving the flu vaccine. Of course, for COVID testing, we need to have better distancing protocols, better non-infectious protocols to prevent people from co-infecting each other. It's definitely a solution to look at. We look at mobile testing. That's a great solution. Drive-through testing is another one. Even at-home testing via the postal service. That's what the Brits use. There are a lot of tools we can still deploy to overcome this testing backlog.
Yeah, as you mentioned, the mobile testing now being implemented in some schools in Saskatchewan, for example. Real quick, when we're talking about testing, saliva testing, it's not available as I imagine or as I understand yet in this country, but is that practical? Would that expedite the process?
That would help enormously. For one thing, it's easier to take a spit test. Nobody wants a swab stuck in your throat or your nose. It's also costs a little less because you need fewer reagents to process it in the lab, and you could do it faster. So I think spit tests will be a bit of a game changer once we get it deployed here in Canada.
Well, hopefully that comes sooner than later. And, you know, obviously we're entering another season, the cold and flu season. A lot of people are getting sick for other reasons other than COVID-19. And talking about the symptoms and trying to tell the difference between them. And in many ways, this connects to the testing, because if people are experiencing any symptom, they may want to get tested for COVID. But how much of a burden would that put on the system?
It's an enormous burden, which is why getting the flu vaccine is so important, to take those flu cases off the table as much as possible. There are some distinct, somewhat distinct symptoms. Fever and body aches tend to be common to both COVID and the flu. The COVID tends to have dry coughs, and you have that lack of smell and lack of taste. GI symptoms tend to be more for COVID and less so for the flu, but there are no hard rules here, right? So it's important that people prevent themselves from getting sick in the first place, so not to overcrowd the hospitals and to make epidemiology more difficult than it needs to be.
Now, we've seen with the recent numbers, a lot of people under the age of 40 make up the majority of the cases. How concerned are you, and what's their message for them?
Okay, so young people, that's those under 40 now, that's young, need to be more careful. Now, they're going to be okay for the most part. Some will suffer and some will die, but the threat is they will give it to older people, and they will. We saw this in France. It takes about 3 to 5 weeks for that younger demographic to start infecting the older demographic. When that happens, the hospital rates are going to increase and the death rates will increase. People need to be more careful.
Important message, as always. Dr. Raywat Deonandan, we appreciate your time. Thank you again.